Okay, and now we move
Okay.
on. Yeah, thank you so much. And we move on
Thank you. Thank you.
to our next speaker, Dr. Shripad Jahagirdar. He's done his MD and DNB in pediatrics. He's the director of Hope Hospital and national trainer for neonatal resuscitation program. He was the organizing secretary for Mahapedivon 2019. So we have already experienced his wonderful skills as an actor, and today we are about to experience his skill as a pediatrician, as an orator, as a presenter. So I think his patients, he might be a favorite of his patients because of his cool and calm nature. So let us move ahead, and over to you, Dr. Shripad.
Good evening. I will share my screen.
So your screen is visible. You can start with the presentation, sir.
Okay, today we will discuss about picky eaters condition. Though this is not common for pediatrician also, but it is for every parents. So these are the things that probably all doctors or all parents should know how to deal with such patients. Okay, picky eaters, they are the children having strong food preferences, consume in an adequate varieties of food, restricting the intake of some food groups, eats a limited amount of food, and are unwilling to try new foods. These are the group of people, they will go on eating only one type of food, and they will not accept or they will not encourage in eating other variety of the foods. We call them as a picky eaters. So picky eaters, the most of the time symptoms onset starts from the age 15 months to 18 months onwards, and most of the time the symptoms resolve by 5 years. But these 3 years are really very painful for parents. These are very frustrating for grandparents. Why the child is not eating, why the child is having so many problems about the diet, even everything is available at home. So really a tough time for the parents during these 3 years. Child has a favorite food but cannot make do with other options. Child is upset if not getting a favored food, may become fussy for few hours. Preference for carbohydrate in such patients. This picky eating may be extreme if the child eating is affecting his social, emotional, or physical development and can causing family conflicts. Sometimes, most of the time, this is a self-limiting condition, will not cause much problem to the pediatric population, but sometimes deficiencies can occur because there is very choosy in eating and most of the diet is not consumed. So they can have a deficiency of iron, calcium, zinc, vitamins. The child's attention and energy level can be less. Child cognitive function can be decreased because of so micronutrient deficiencies. Immune system may be affected, recurrent infections, weight gain problems, dental problems may be possible. Now let's see what parent can do. So there are very simple tips. These are ideally for picky eaters, but we can take it for most of the eating problems for the children. For in most of the eating problems, same guidelines will follow. Parents has to be a role model, involve entire family. Patience is the key. Remember, even the parents can be one of the parents can be a picky eater when he was a child. So most of the time the parents complain that bachcha khata hi nahi hai. But always remember very simple rule. Parents can control what, where and when food can be provided. And child will always decide whether or not to eat the food and how much to eat. So we cannot control everything. We can control what child can eat, where child can eat and when food can be provided. But we cannot control how much child can eat and whether child will eat or not. So it's his choice. Often other variety of age appropriate foods, your child should select from the variety of the foods at meal time, vegetable, fruits, protein, starch. The family menu should be limited to 15 times before they can accept it. It is not a loosening condition. Hello. Hello.
Sir, you are audible, sir. Sir, you are audible. You can continue.
Most of the
Hello, Shripad sir, please kindly switch off your video. Over to Anuradha, ma'am.
Dr. Shripad, can you please continue? We can do it without your video also. Am I audible to you?
Yes, ma'am, you are audible, ma'am.
Yeah, am I audible to Dr. Shripad?
Ma'am, Shripad sir have left the meeting.
Okay, there's some issue with, okay, some technical problem. We'll wait for a minute and then we will move on.
Okay, ma'am.
Dr. Anuradha, madam?
Yeah, yes, sir.
Yes, Dr. Shripad sir is joining from a different device. So
Okay.
he said he will present. Just
Okay,
give him a
okay.
minute. Yeah.
Yeah, we'll give him a minute. And it's definitely a very interesting and an important topic. In every household, of course, we face this problem of picky eaters, and we really don't know what to do. So definitely we would like to listen to him. Are you there, Dr. Shripad? Yes, over to you, Dr. Shripad.
Shripad sir, please on your mic, sir.
Okay. Share the
Shripad sir,
responsibility.
sorry to interrupt you. You can share your screen, but please switch off your video.
Okay.
Okay. So that will give you a better bandwidth.
Okay. Now slides are visible. I can talk from other thing. Hello.
No, sir, slides are not visible, sir.
Let me check. Okay. Now slides are visible.
Yes, sir, slides are visible, sir.
Your child should select from the variety of the foods at mealtime. Vegetable, fruits, protein, starch. The family meal should not be limited.
Shripad sir, your mic is not on, sir. Shripad sir, your mic is not on, sir.
Hello.
Yes, sir, you're
The child
audible
may
now,
not
sir.
eat the foods you provide, because if child is consuming too much amount of juices, soda or milk, then probably food intake may be less. So try to see this factor, and liquid intake in the form of soda or cold drinks should be avoided.
Sir, you're audible, sir. You're audible, sir.
Okay, so
Okay. All thing is fine, sir. You're audible, sir.
but बंद करके साइड बंद कर. Hello.
Yes, sir, you're audible. You can start, sir.
Okay, set a meal schedule, which is very important. Set a schedule of breakfast, mid-morning snacks, lunch, afternoon snacks, dinner, bedtime snacks. Let the child know that there is a meal coming every 2 or 3 hourly, and they will not go hungry. Avoid giving your child food between the scheduled times. If your child chooses to skip a meal or a snack, he or she can wait for the next scheduled time for a couple of hours. If your child refuses to eat, have him or her sit in the table until the other family member finish their eating. Not that I have finished my feeds, I will go from this dining place. Not everybody will start the dining at the same time, and everybody will be there till the last person finishes his lunch or snacks. Conservation should be very pleasant during dining. The eating place should be clean and bright with no distractions. And most important is, mealtime is not the time for watching television or arguing. So most of the time, the food should not be decided by the what TV serials emotions captures. If the TV emotions are very serious or very frustrating, then child may not eat. So TV watching is or mobile watching is strictly avoided during mealtime. So everyone has his own quirks about eating. Respect that food that your child eats today may not be eaten tomorrow, which is very important. Mother always say, okay, last time whenever this food was prepared, everybody likes it and you also liked it. Now why you are not taking this feed? So this will not happen. Every time child may not like the same feed, or sometimes the child will like to have different feeds. Always offer some different substitute foods. If your child doesn't like or doesn't seems to be eating the food, then you have prepared for a meal or snack, it's okay. Avoid that temptation to return to the kitchen and start preparing another food which is favorite for the child. We will always say in this manner, okay, this is for today, tomorrow we can have, or day after tomorrow we can have the food that you like. Today whatever has been done is liked by most of us, and you have to accept that, and you have to start eating these foods also. So our parents' nature or parents' attitude should be changed. Liking of the foods or acceptance of the food is not emergency. You can always tell, we will not prepare the food that you like today. Whatever has been prepared, you have to eat today. So if the child is forced to eat the entire meal before the dessert, he may be full by the time the dessert is available. So child may in between the feeds go to and take the dessert on his own. So if this is happening frequently, the parent should see that you can bring the dessert with the meal also, so that child can enjoy the meal, child can enjoy the dessert also. Again, the dessert should not be a rewarding condition, that you finish all this milk and you will get the dessert. This should not be the attitude for the parents. Even if the child sometimes doesn't able to finish his lunch, still if you are offered dessert, then prepared for the dessert, then go with the dessert. Everyone in the family should enjoy the desserts. So these are the few take-home messages how parents or how everyone can deal with these picky eaters. So this is a mnemonic one can remember. P is prepare one food of their choice. I, involve your child in food making, decision making of kitchen. Cook variety of the foods. Patience is the key, which is most important for all the parents. No yelling at meal time, no fight at meal time. Eat with the family often. Avoid forcing meals. Decide timetable, and timetable should be fun time. Encourage healthy habits. Be a role model. Parents has to be a role model. Serve small portion of the feeds. Okay, thank you. Though it is a difficult theoretically it looks simple, but when is a practical pediatric patient is there, it is always difficult for the parents. So patience is very important. That is, I always tell the parents. Thank you very much.
Thank you so much, Dr. Shripad Jahagirdar, for a wonderful presentation. And we really got very practical tips from your talk, especially the wonderful way in which you have made the acronym Picky Eaters, and you've given the summary in a beautiful way. Very important tips like being the role model and not watching television at the time when we eat food. All those will be very, very